current position, I was the assistant director of the FSU Psychology Outpatient Clinic and continue as a doctoral candidate in the clinical psychology program at FSU under the advisement of Dr. Thomas Joyner. I am humbled and blessed to be here today as the director of the statewide Office for Suicide Prevention, and look forward to continuing the progress forward to decrease and prevent suicide-related experiences among Floridians. So I'm going to let Amanda do an introduction, kind of introduce herself, and then I'm going to provide a little bit more information about the statewide Office for Suicide Prevention itself. So Amanda, if you want to go ahead and take it. Amanda, it looks like I'm having trouble hearing you. I don't know if everybody else is. Not yet. Maybe in your devices settings. Sorry, y'all, it's this technology. Still having a hard time. It might be within your Zoom settings for the. Not quite yet. So Amanda, I'm going to go ahead and give your bio so we can keep moving forward, and then we can kind of hopefully figure it out for the proclamation side. So Amanda joined the statewide office as our suicide prevention specialist in February of 2021, so she's still pretty new with us. Prior to joining DCF, Amanda worked with local behavioral health agencies in Tampa, Florida, providing services to individuals with severe and persistent mental illness and those with dual diagnoses. So during her time in Tampa, Florida, Amanda had the ability to collaborate with various mental health stakeholders, including public defenders, law enforcement, and community agencies. Amanda graduated with a Bachelor of Arts in Psychology and a Bachelor of Arts in Spanish from the University of South Florida. In 2020, Amanda graduated with a Master of Social Work degree with a concentration in adult mental health and wellness from the University of Southern California. So we're very lucky to have her on board with us as that suicide prevention specialist, essentially kind of doubling the workload that we can do in the statewide office, which is awesome. I am going to briefly share my screen here, and we'll do a quick overview of, make sure I share the right thing, the quick overview of Florida's suicide prevention infrastructure. This is the organizational structure of our state suicide prevention. As you can see, the statewide Office for Suicide Prevention is there in the middle, and we clearly have a robust and expansive infrastructure within our state, which is really awesome. We have a lot of stakeholders and individuals involved. The statewide office is a mandated office. It's mandated by statute. It was first started in 2007, and it was housed in the Florida Office of Drug Control within the Executive Office of the Governor. It was later moved to the Florida Department of Children and Families in 2010 under the Office of Substance Abuse and Mental Health, where it is currently housed. During the 2020 legislative session, the office was expanded by Senate Bill 7012. So more specifically, the office is tasked with chairing the Suicide Prevention Coordinating Council, which is a legislatively mandated group of 31 agencies and organizations across the state. Let's see. Furthermore, the office and the coordinating council work together to write the Suicide Prevention Annual Report, which provides an overview of the yearly suicide prevention activities, and it also identifies recommendations for our future efforts and priorities. We are tasked with developing the state plan for suicide prevention. Our most recent state plan was published at the end of 2020 and will guide suicide prevention efforts for the state through 2023. Importantly, it's through interagency collaboration across the coordinating council and various other stakeholder groups that will really drive this plan forward, which is very exciting. And finally, the statewide office for suicide prevention maintains the suicide prevention website as a clearinghouse for resources for Floridians across the state. And we also strive to connect people with resources. So I really want to extend a huge thank you to Tara and the American Foundation for Suicide Prevention for putting this together, today's event, and for all of the important information that we're going to learn about suicide prevention and what's going on in our advocacy efforts. I did want to make sure that everybody has both mine and Amanda's contact information. So I'll put that on the screen for you. Please do not hesitate to connect with us with questions, concerns, ideas for collaboration, anything that you would like any effort or extra help on, please do not hesitate to reach out to us. So we will see now if hopefully Amanda's worked out her vocal issues, and she will read us the proclamation for today's suicide prevention. Go ahead, Amanda, if you have that.
All righty, can you hear me?
Yes, much better. Thank you.
All righty, great. So I'm going to go ahead and read the proclamation as Anna just stated. So, whereas suicide has a devastating impact on families and communities and is the 8th leading cause of death in Florida, and whereas suicide deaths and suicide-related thoughts and behaviors are public health issues that claimed the lives of 3,427 Floridians in 2019, and whereas the Florida Department of Children and Families is committed to working with state agencies, community partners, school districts, law enforcement agencies, first responders, and healthcare providers to identify goals and specific action items to reduce deaths by suicide through evidence-based and evidence-best practice programs. Whereas the Florida Suicide Prevention Coordinating Council works to identify ways to increase awareness, education, effective intervention, and follow-up support to prevent further suicide tragedies. And whereas the chair of the Florida Children and Youth Cabinet, First Lady Casey DeSantis, has focused the cabinet's priorities on supporting mental health and resiliency for our youth. And whereas the statewide Office for Suicide Prevention within the Florida Department of Children and Families is collaborating with the First Responders Suicide Deterrence Task Force to identify evidence-based practices to address suicide-related thoughts and behaviors among Florida first responders. And whereas the National Suicide Prevention Lifeline at 1-800-237-8255 provides support 24 hours a day, 7 days a week for anyone struggling with thoughts of suicide. Now, therefore, I, Ron DeSantis, Governor of the state of Florida, do hereby extend my support to all observing March 25th, 2021 as Florida Suicide Prevention Day.
Thank you all so much. And we will go ahead and push it back over to Tara and her team for the remainder of the event.
Thank you so much to both of you. We appreciate having you on our call and joining us today and providing us with such great information. Next, we're going to move on to suicide facts and figures. And when talking about suicide, it is important to use safe messaging. FSP advocates come from many different backgrounds. Some have lost a loved one to suicide, some have had their own struggles or support someone that struggles, and some are professionally invested in this space through their work. Telling your story can save lives, but only if you share it safely. Sharing your story lets people know they are not alone and shows them recovery is possible. If done safely, your story will encourage people at risk to seek help. Remember, you should be in a safe place in your recovery. Avoid discussing details and method, as this may be triggering for those around you. Avoid glorifying suicide by using terms like successful attempt, but instead say completed suicide or death by suicide. Avoid using the word commit, as we often relate this word to crimes. Instead, say someone died by suicide or took their own life. Share mental health resources such as the National Suicide Prevention Lifeline or the Crisis Text Line. Finally, practice. The more comfortable you are in sharing your story and talking about suicide, the more we can break the stigma associated with mental health and suicide. The Centers for Disease Control and Prevention, or the CDC, collects and shares data on the number of suicide deaths in the United States each year. It typically takes 2 years for this data to be published. So the most recent data available that you see here are from 2019. Suicide remains the 10th leading cause of death in the United States. In 2019, we lost 47,511 Americans to suicide, making it the second leading cause of death for ages 10 to 34 and the fourth leading cause of death for ages 35 to 44. Over a third of those, it is estimated that for each suicide death, there are 25 attempts, which works out to be more than 1 million attempts a year. And as you can see here, this is our our AFSP national fact sheet. This is also available on our website at afsp.org/statistics. What you are seeing is a comparison of suicide rates across the country. You can see that Florida is in the middle third of suicide rates in the US. It is important to remember that even for states in the lower third of suicide rates, there is still work to be done. Locally in Florida, suicide is the 8th leading cause of death. For our youth and young adults ages 10 to 44, suicide is the 3rd leading cause of death, and suicide is the 2nd leading cause of death for those ages 25 to 35. Suicide is the 4th leading cause of death for ages 35 to 54. And this is our suicide data Florida fact sheet. We will be emailing this to you afterwards, after this presentation, so that you have this data and this sheet available, but you can see the statistics on there as well. Now we're going to go over our advocacy program and kind of talk to you about what it is and what you can do. So why advocacy? By advocating for the issues that you care about, like suicide prevention and mental health, you can make a difference. AFSP provides advocates the opportunity to share your story and make connections with lawmakers at both the federal and state level. We also provide a platform, the AFSP Action Center, which allows you to email your legislators directly. Advocates can also advocate in the future at in-person events both locally and around the country, as well as in Washington, D.C. AFSP volunteer field advocates make an important impact in many different policy areas for suicide prevention and mental health. Policy priorities are determined every 2 years by the National AFSP Public Policy Council and the Public Policy Office staff in Washington, D.C. Staff work with chapters to determine where the gaps are and which policies will make the biggest impact for each state. You can visit afsp.org/priorities to find more detailed information on our top policy issues and to view and download our full list of priorities for the next 2 years, the 2021-2022 Public Policy Synopsis. Again, we will drop these to you in an email so that you have them. So where does our legislation come from? First, for those who may be new to advocacy, we want to address this question. It comes from the legislators themselves based on their personal experience, passions, and interests. It comes from you as advocates and constituents. And it comes from organizations like AFSP that work directly with other work directly with legislators and leading mental health organizations to write new policy and provide resources to support future legislation. Once a legislator has an idea for a bill, they will draft language and introduce it. Once introduced, the legislation is assigned to the relevant committee within the House of Origin. This is either the House or the Senate. For example, if we work with a senator to introduce a bill to have all teachers trained in suicide prevention, that bill's House of Origin is in the Senate, and the bill will be sent to the Senate Education Committee. The committee then has the opportunity to review, edit, and vote to approve the bill language before sending it to the floor for a full vote. If the bill is voted on favorably, it will go to the other house. So our teacher training bill, for example, if approved by the Senate Education Committee, would go onto a vote by the full Senate, and only if the Senate votes favorably on it, it would be moved to the House and then go through the same committee review and floor voting process. Only when a bill has been voted on favorably in both houses can it go to the governor to be signed into law. Once received by the governor's office, the governor typically has a set number of days to act on the bill by signing it, or by vetoing it all, or even parts of the bill and sending it back to the
You get
House.
it?
Additional edits recommendations.
What happened?
In many states, the governor also can choose not to sign or veto the bill and can instead allow the bill to become law without signature. If everyone could just put themselves on mute, that would be great. I'm just hearing a little bit of feedback. So when speaking to a legislator or their staff, it is important to be polite and to thank them for their time. You may also want to be mindful of the language that you use, as we discussed before, and be brief when sharing your connection to the cause. Think of it as an elevator speech. You want to provide them with a very short introduction. Hi, my name is Sarah, and I have been affected by suicide through the loss of a close friend, and have also had my own struggles and thoughts of suicide. I look forward to sharing more information with you about our local AFSP chapter and how we can work together to prevent this leading cause of death. I'm also happy to answer any questions that you may have. In your communication with your legislative office, if you don't know the answer, that is okay. Just say, I don't know the answer to that right now, but I'm happy to find out and will follow up with you as soon as I have the answer. This provides you an excellent excuse to maintain communication with that office and further your position as a resource. There are lots of ways to build relationships and stay connected with your lawmakers throughout the year. You can email or call them through the AFSP Action Center. You can tag them in social media posts, meet with them or their staff virtually over the phone or by video. Sign up for their newsletters so you know when they are hosting town halls and events in your area. Many town halls and legislative meetings are now being held virtually and offer increased opportunities for advocates to become engaged in the legislative process. As you begin your advocacy journey, it is important to know what resources you have at your disposal. State legislative websites offer several resources to advocates. You can identify your legislator and their contact information. You can see what laws are currently enacted and search for legislation that has been introduced in the current legislative session. Advocates can also sign up for newsletters and find out what relevant events and advocacy opportunities may be coming up in their area. If you are interested in learning more about the specific policy areas that AFSP works on, both at the federal and state level, there are several resources that AFSP provides to you. Our Public Policy Office has hosted and shared policy-specific webinars, filmed sample meeting videos for new advocates, and created issue briefs for each policy area that explain AFSP's policy position and show what laws are in place in each state. You can also visit the AFSP Action Center at any time to see what legislation AFSP supports and where the bills are in the legislative process. As you can kind of tell, it's a long process for a bill to become enacted, so it's important just to stay involved year-round and to keep up with your legislators and keep up on the issues that are happening. Now I'm going to turn it over to Tara, and she is going to go over our Florida state public priorities, our policy priorities.
Thank you, Sarah. So I'm excited to share with you guys some of the public policy priorities that we have set for our day at the Capitol. Prior to this meeting, if you were signed up to attend, you should have received our Florida issue brief. So I'm taking all of those pieces from our Florida issue brief, and I'm going to go over them one by one. And so you should already have a copy of this, and I will email it out again afterwards. But our first priority is 988 implementation and call center funding. So the National Suicide Prevention Lifeline is 1-800-273-8255, and it is manned locally by local crisis centers all over the state. I believe there are 12 of them here in the state of Florida. Callers are connected with a call center, and they're able to connect with resources. Right now, there are a lot of calls coming through, and sometimes when the calls come through, they roll over to other states. And really, honestly, we would like them all to be housed here in Florida so that we can provide people with a local touch. So statewide crisis lines help to ensure that the gaps in local services and delivery areas are served and that calls are answered 24/7 by individuals trained to handle suicide risk and other mental health crises. Although the Lifeline has been proven itself to be an essential and necessary component of the suicide prevention and mental health care system, the network of crisis centers consistently faces two main interconnected barriers in its effectiveness and success, and that's insufficient funding and capacity to respond to the increasing call volume. So while the Lifeline is a national program, federal funding goes towards managing call routing, best practices, standards, public messaging, and technical assistance. Local call centers rely on funding from state and local contributions to operate and grow their centers to meet that volume. And many rely on private contributions and volunteers to keep those call centers running. It's critical for the state governments to provide funding to crisis centers within the Lifeline network to make sure calls are answered in state. So in October of 2021, the National Suicide Prevention Hotline Designation Act became law. This designated 988 is the future 3-digit phone number for the National Suicide Prevention Lifeline. It requires full implementation and access by July of 2022. It empowers state to enact laws following 988 to be funded the same way we fund 911 through monthly customer service fees. Timely access to mental health and crisis services can be life-saving. AFSP urges states to pass legislation enacting a customer service fee for 988. Call centers will have the capacity to answer increased call volume. Call centers can be connected 24/7 with a center in their own state, and call centers are equipped with resources to connect callers with wraparound services and care. So here, if you don't already have some of these crisis numbers stored, I really highly encourage you to take a screenshot of them. As you can see, there's the National Suicide Prevention Lifeline. There's the crisis text line, the Trevor line, which helps support LGBTQ youth, the trans line for support for transgender people, and the SAGE LGBT Elder Hotline. So these are all accessible, and you can see the hours of operation. Most of them are 24/7 with the exception of the Trans Lifeline, which is from 10 a.m. to 4 a.m. Eastern Standard Time. So in summary, full implementation of 988 will result in higher call volumes nationwide and here in Florida. So why 988? 988 is much easier to remember. There will be national efforts to promote use of the number, and Floridians will continue to face stressors related to COVID-19 pandemic. Increases in call volume will require more trained personnel to answer phones, mental health professionals to train and supervise these shifts, and advanced infrastructure upgrades will need to occur. And we need to plan for 988 implementation right now to ensure that the state and the local call centers in Florida can handle this increase in volume and respond to all Florida 988 calls quickly, efficiently, and help in the continuum of care with crisis services. So the end result will be a system that is better equipped to meet increased community crisis needs and avoids callers relying on more costly and less effective emergency services. So currently right now, we do not have any legislation that I'm aware of. So this is something that we'll need to discuss in our legislative visits as something that we certainly need support on. So in 2018, fees for 911 generated $2.6 billion to support that service. Similar investments must be made for mental health and substance use crisis. Florida can and should enact such legislation. AFSP is advocating across the country and right here in Florida to pass bills to put these fees in place. But fees shouldn't be the only source of funding. They will be critical. Sustainable sources, state governments should also appropriate general funds for call centers and crisis services. AFSP supports model legislation developed by the National Association of State Mental Health Program Directors. And to date, to my knowledge, Utah has been the first state to pass legislation creating a statewide behavioral health crisis response account. So that's exciting to know that one state has already passed such legislation to fund the needs for 988 in their state. So our second priority is first responders and veterans and mental health. So the bill that we do have a bill that's currently in our House and Senate. It's sponsored by Senator Harrell and House Representative Zika. It requires the support of Veterans Affairs to establish the Florida Veteran Care Coordination Program to provide behavioral health to healthcare referral and coordination services to veterans and their families in order to prevent veteran suicides and increase use of VA and community-based programs and services. So the next one really deals with post-traumatic stress disorder and coverage for first responders. Research has shown that first responders are at elevated risk for suicide and has highlighted the link between PTSD or PTSI and suicide attempts and deaths amongst first responders. Police officers and firefighters are more likely to die by suicide than they are in the line of duty. And first responders often experience occupational hazards and stressors on the job, such as traumatic events on their work shift that can increase risk for suicide behavior, exacerbating existing risk for suicide and other factors. So first responders face barriers in seeking mental health care and tend to work within a culture that discourages showing signs of weakness, and that can contribute to a reluctance to seek help. So first responders can face a fear of job loss due to the disclosure of their mental health conditions or suicidal thoughts. So we owe it to our first responders to create a culture that is supportive of their mental health needs. So AFSP supports laws to allow first responders to claim PTSD and PTSI as an injury without the requirement of also being accompanied by a physical injury. So we're asking for support for an existing bill, an existing law, which is Senate Bill 1224, which is sponsored by Senator Jones. And on the House side, it's by Wilhite. So this existing law provides that post-traumatic stress disorder, PTSD, suffered by a law enforcement officer, firefighter, emergency medical technician, or paramedic is compensable injury where clear and convincing evidence indicates that PTSD was caused in the course of employment and that the individual receives a diagnosis from a licensed psychiatrist. And I think that builds on SB 1224 and House Bill 1171, adds 911 public safety telecommunications operators to those lists of eligible benefits because they are obviously taking the calls and are experiencing this stress at work as well. So our third priority is Mental Health Parity and Transparency and Accountability Act. If you've been with us for more than one state day at the Capitol, this is a reoccurring ask that we always have and know that it is incredibly important. So this year, Senator Rowson and on the House side, Representatives Silvers and Schlossberg are supporting bill for mental health parity. It requires one, that Medicaid managed care and commercial insurance plans to report annually to the Agency for Healthcare Administration on parity law compliance. And two, that the Office of Insurance Regulation, or OIR, to implement and enforce the federal parity law. So this is law on the federal level. It just needs to be have some oversight here in the state of Florida. So OIR to submit related reports annually to the legislation. It also removes language allowing for only optional coverage for mental health and substance use disorder. This is incredibly important. So our fourth priority is student mental health and suicide prevention. So Senate Bill 1410, sponsored by Senator Jones, and House Bill 1073 by Representative Woodson, requires school boards to adopt policies to provide mental health services for students in grades 9 through 12, which address mental health professionals in the school setting, a continuum of services available during the school day to facilitate better access to such services and outcomes. And then 3, procedures to aid a student experiencing a mental health crisis on a school campus, including the use of mobile crisis units and methods for engaging the student and their family and continuing mental health treatment. So next, with under the education piece would be including crisis resources on student ID cards. So crisis resources for students. Students must be equipped with the tools to reach out should they experience a mental health or suicidal crisis. Transparency and easy accessibility of information can reduce stigma surrounding mental health conditions and reinforce the notion that it is a sign of strength to reach out for help when you're struggling. And then by offering immediate help to everyone that may need it, crisis lines provide invaluable support at critical times. AFSP supports efforts to include numbers for the National Suicide Prevention Lifeline, which is that 1-800-273-8255, and other local crisis services on all student ID cards for grades K through 12 schools and institutions of higher learning. So here in the state of Florida, we currently do have a piece of legislation that addresses this within our schools, required Senate Bill 1218, sponsored by Senator Jones, and House Bill 489, sponsored by Representatives Daley and Woodson, would require school principals to ensure that crisis prevention and behavioral health hotlines and text numbers are printed on the back of student IDs. So there are 7 other states right now that already have passed similar legislation that requires this, and that's Arizona, California, Kentucky, Louisiana, Maryland, Michigan, and Wisconsin. So what are some action items? So we're encouraging you right now to take action by reaching out to your legislators. You can email your legislators through the AFSP Action Center, and that's afsp.org/action center. For those looking to take action, we can work with you to schedule a phone meeting or a Zoom meeting with a legislative office. You can share your personal story and your personal vignette. If you had indicated when you registered for this event that you were interested in taking legislative appointments, you should have received earlier today an email with both your senator and your House representative's contact information, along with 4 or 5 different attachments, including our public policy priorities, our Florida State fact sheet, some templates for requesting the meeting, as well as how to follow up once you've had your meeting and how to log that you've actually gone on a meeting. So, so just to kind of schedule a phone meeting or a Zoom meeting, share your connection to the cause, and you can personalize that vignette, engage your community by recruiting other people, and then promote suicide prevention on social media using the hashtags AFSP National and AFSP Advocacy, as well as with your legislators. You know, I know typically when we go out to Tallahassee, we love to take photos, but maybe this year you can take like a Zoom screenshot of your meeting and share it and let people know that you had the opportunity to meet with your representative. So this is just an example of what our Action Center looks like when you go to afsp.org/Action Center. The Public Policy Office has set up an Action Center on the AFSP website. Advocates are directed to this Action Center through a link, and you can email your legislator in as little as like 2.5 minutes. It's very, very easy. You just put in your address and it automatically populates who your representative is. And you can choose to customize the message, or you can use the standard message that is already created for you. Don't forget that you can share the general link to the AFSP Action Center with anyone. You can share it on social media. You can send it with to your friends and your family, and you can encourage them to reach out to our legislators to support mental health and suicide prevention initiatives. So for those interested in meeting with a legislator and our staff over the phone or in person, there are a few things to keep in mind. First, you want to practice that elevator speech that Sarah mentioned earlier, and make sure that you feel comfortable briefly sharing your story. One easy way to practice is by filling out a written vignette, like you'll see it in the next slide, that can be shared with the legislative office before and after your meeting as an email attachment. The vignette includes a photo of yourself, or you can share a picture of your loved ones and a few sentences about why suicide prevention is important to you. Typically, legislative meetings are about 10 to 15 minutes in length, so you may not have a time to talk on every one of those topics that we just went over, those priorities. That's why we encourage you to select one area that you'd like to focus on and briefly speak to that and why you're passionate about it. Legislators will receive an electronic copy of the issue brief from you and from us if you're not able to talk with them about all of the priorities. Remember, that's okay. Finally, don't worry if you received a question that you don't know the answer to. Like Sarah mentioned earlier, simply say that you don't know, and you'll be happy to find out the answer for them and follow up. This gives the opportunity to stay in communication with that office and build up that relationship. The Public Policy Office is happy to work with all advocates to answer these questions so you can follow through on your promise to be a resource for your legislators. So, and after the meeting, the legislative office is important to follow up and offer yourself and the chapter as a future resource. You should send a personalized thank you note and a copy of your vignette if it wasn't already shared in the prior meeting. The vignette provides the legislator and the staff with the name, a face, and a story. It really makes it real for them, and ultimately a reason to vote in support of suicide prevention and mental health. So for those who indicated on their registration that you were interested in scheduling a phone and meeting with your legislator, we have a final few reminders. You should have received the email from the chapter that includes the name and the contact information of the legislative office that you're assigned to meet with, a sample meeting request email that you can use to get your meeting scheduled. You got a link to legislative meeting feedback form so you can share the information about what was discussed on your call and if any follow-up is needed. So this would definitely be an area if you got a question that you didn't know the answer to, or you needed some additional help to follow up. You should definitely put it in there. It'll help us to remember, what really stuck out in the meeting. And then finally, a sample thank you email was attached in that email. So you can send out that as a template and customize it to the talking points that you went over in your meeting. We can also assign a partner for any advocate that may be unsure about a meeting with a legislative office. So if you get in a meeting and you're a little bit scared to go, maybe by yourself or pick up the phone, you can reach out to either myself or to Sarah, and maybe we can partner you with a more experienced field advocate, so you can take that meeting together. If you did not receive this information, but you want to make a legislative appointment, you can also email me. I'll put my email in the chat box after I'm done talking, and I think it's on the next slide, so you can copy it down from that next slide. So connect with your local chapter. We have 6 AFSP chapters all across the state of Florida, and you can see each of the individual websites. On our local chapters, you can see various events that we have coming up. I'm going to do a small plug for our statewide campus virtual walk that's taking place on Saturday, April 24th. We're encouraging anybody to form a team and walk with us, whether they're in high school or college or just a general member of the community. They can walk with us virtually on April 24th in support of suicide prevention. And you just go to afsp.org/FL campus to register. I want to say thank you. And right now I want to open it up so that we can answer any questions that you guys might have about any of the public policy priorities, or about taking a meeting or going on a meeting. So I'm going to stop share and open it up for any questions.
Sarah, hey, this is Rachel Burns, Escambia and Santa Rosa counties in the Panhandle. There are a group of us who are connected with the Escarosa Suicide Prevention Coalition who would like to attend legislative meetings together. When I was registering, I accidentally did not click the box that said I wanted to do the legislative meetings, so I haven't received that. If you could add me to that, I would be glad to help coordinate that for our group. We'd like to do that together rather than us doing it individually with legislators.
Sounds good. I will add you.
Thank you. And if anyone else on this call is not connected with the Escarosa Suicide Prevention Coalition and would like to, but lives in this area, I'll put my email in the chat and you're welcome to contact me.
Thank you, Rachel.
Thank you.
And we know this is a lot of information, and that's why we're just encouraging you to just take your time to read through it all, to really understand it. And also another thing is when we go to Tallahassee, a lot of times we don't get to meet directly with our state representative or our state legislator. We meet with their staff. So if you do reach out for like a Zoom meeting or a phone call meeting, know that it's okay to meet with their staff as well, because they're just as effective, if not more, in relaying the information to the legislator. So just know that that's okay as well.
Hello, can you hear me? So I just wanted to give a shout out. My name is Nan Prevost, and directly related to your organization, AFSP, and with Tara. She is how I got linked to from the walk with Out of the Darkness in St. Petersburg. I was invited to go to Tallahassee last year to share my story, and I was a greenhorn at all this, so I was just particularly there just to share my story. And it was with the courage and education with the AFSP and the state legislators that I was able to meet there. And I'll tell you who they were. One of them was Chris Lavala and Jennifer Webb. they gave me the strength. They heard my story. They gave me the strength and courage to go ahead and bring my mission of educating the public about suicide prevention and decreasing the stigma as well. So I just released today, I created a nonprofit now for suicide prevention, an interventional program in our community for suicide prevention and trying to reach our youth. Kind of like a main hub to where I can work with the community firsthand. It's a nonprofit and I just got approved today. So I'm very excited about this, and I plan on working with AFSP as far as with the education and supporting our legislation with you and all the Senate bills. So I'm going to be a very strong advocate driving forward and working with our community leaders here, which I've already been working with the sheriff's office now, the victim advocate, and also with the city of Largo community housing and Indian Rocks Beach community housing first responders. So I've really made great stride, and I really owe it to your organization, and I'm 100% on board with supporting whatever you guys need. And so I thank you for that. And I just found out, and I'm not really sure if Tara even knows this, but I found out there's a crisis hotline. It's a 211, and it's called Tampa Bay Cares. And it's a first responder, and it reaches out to everyone in the Tampa Bay area for everything that we're talking about with the 988. And it's for anyone, it's for like homeless, it's suicide prevention, homeless, adult family, and veterans. And it's a hotline, and it's a 24/7 hotline. And I didn't know if you guys were aware of that or not.
Yep.
Oh, okay.
Nan, I want to say congratulations on the work that you're doing, and thank you so much for sharing your story at last year's State Capitol Day. And yes, 211, they operate, many of them operate the 12 crisis center units across the state, but not all. So depending on where you are with the coverage is which center you're going to get linked to. I think in the Tampa Bay area, there are actually 3 211 call centers. There's 2 in the Pinellas and 1 over in the Hillsborough side. So yep, they are a great resource, but we also want to continue to share the National Suicide Prevention Lifeline number with folks so that they know that that's accessible to them.
Yeah,
so we have a couple of questions that popped up in the chat box that I certainly want to get to. Mm-hmm. So one of the first questions that I saw was from Angelina. So she asked, for the school mental health bill, is funding attached to the requirements for the school districts? And that is a very good question. And I don't have the exact number because on my issue brief, I wasn't seeing any dollars attached to that. So Lena, I will follow up and find out if that has some dollars attached to it. The next question I saw in the chat box was from Al Goldwasser. He said, who pays for the fees for the 988 calls? Who are the customers? So I think if you get like a cell phone bill, you'll automatically see like you get like a 911 service fee kind of a charge. And somebody actually text messaged me this morning that they got an email or text message from T-Mobile. I have T-Mobile and did not get this. The FCC has adopted 988 as a 3-digit number to be used nationwide to reach the National Suicide Prevention Mental Health Crisis Center. Impact areas will permit 10-digit calling. And then it has a little bit more information T-Mobile sent it out, but it would be through service fees. I think that would be passed on to the customers in addition to trying to find state and local government funding to go to these centers. So the next question I saw. So for anybody who joined late or joined at all, this has been recorded and I'm hopefully going to get it off the cloud somewhere, wherever the cloud is, and be able to upload this presentation to YouTube. And it will take me some while to first download it from the cloud and then upload it onto YouTube. So as soon as I do, I will share it on our social media websites. And I will also send it to you a link to the YouTube video so that you can share or watch it with someone else. Did anybody have any questions about scheduling appointments or any of the materials that were emailed over to you in advance?
I have a quick question, actually. Since I represent the student group Active Minds at UCF, I was wondering if it's okay with the legislator I contact, if other students from Active Minds can also just be in the Zoom with me and like at least be there to support, even if they're not necessarily speaking aloud.
Yeah, I would say absolutely. I mean, I would just let your legislator know, how many students that you anticipate might be able to join you. And I want to say, what a great job you guys have done with your campus Out of the Darkness Walk page, how you guys have incorporated Twitch. I was watching the videos of the young gentleman eating the hot peppers. So there you go.
Oh, I didn't realize other people were watching it. Yeah, no, it was a really great partnership that we did with our esports team on our campus, who is really great and nation ranking. We weren't expecting to raise that much money in a short amount of time. And I think another gentleman, after two of them had to eat hot peppers after reaching the $250 goal, another gentleman got pied in the face for
I haven't seen that one.
$500. So I also have to get pied too at some point on the day of the walk because we reached our goal.
Way to go. You guys are really doing a good job. And thank you for your support. And I know that your voices will really make a big impact on your legislative visits. They love to hear from college age students. So thank you.
Thank you as well.
I have a quick question also. I've heard through the grapevine that my legislator, and he's new to me, I just kind of moved houses, but I've heard has some kind of personal family experience, either to mental health or suicide. Like, what's the best way to find that out, like what that connection is?
Yeah, it's a great question. Many times when you go on your legislative visits, I feel like we're going someplace, but we're going to be on Zoom. You can share your personal connection with the cause. And then a lot of times if you ask them, do you have a personal connection to this cause? Many times what you'll find is, yes, they do have a personal connection and they will share their impact. I had a legislative appointment a few weeks ago with my representative. And she, as soon as after we had our conversation, she opened up to me and shared her story of having lost a neighbor, her neighbor's daughter who was, close to her. And she said, please keep me abreast of the work that you're doing and let me know how I can be supportive.
Thank you.
I may have a question, and it may be a simple answer, but is there, like, if you become interested in trying to really organize a walk in the future, I assume there's plenty of resources available on the website, or like if you don't even know where you would start. We did one, but the one that I did before, I was still too into everything that was going on. I wasn't in charge of. I kind of just, they carried me through it. So what kind of help is there for organizing a walk if you're interested in doing that?
Yeah, where are you located, Kimberly, just so that I can get you plugged in with the right area?
Okay. I'm sorry now.
Were you on my AFSP 101?
I think I did go through.
Okay. Yeah, so you're kind of in a
I'm in a weird area. I could be
in a weird area. So there is a walk in Ocala.
Yes, that's the one we did before.
Yeah, so I would recommend going more towards that walk. And just due to COVID this past year, all of our walks were in virtual. So this year we're hoping to move forward and plan in-person events. So Ocala would be a walk for you.
Okay. That would be good.
I remember we spoke a couple weeks ago. You're in Sumter County, correct? Good to see you.
You too. Thank you.
Glad you're on here today.
Me too.
All right, well, if there's no further questions or anything, we will get that information and everything out to you as soon as possible. Just give us some time. And then we thank you for attending today, and we appreciate you and we're grateful for you. And please reach out to us and let us know if you need anything or have questions or whatever. We're here for you as a resource as well. All right. Thank you, guys. Have a great rest of your day.
Thank you.
Thank you, everyone.